Good morning and welcome to everyone. Thank you for joining this webinar on using planning and devolution to deliver healthy and active environments. We have a great range of speakers today to share their views on this topic, which I'm sure will spark an interesting panel debate. I'm Emma Jolly, an associate at Sistra in the London Development Planning team, and today's topic is something I'm particularly interested in, considering the importance of delivering people-centric development to deliver healthy and active environments, and the opportunities and challenges which devolution plays in achieving this vision. So before I introduce the speakers for today's webinar, I'm very pleased to announce that entries are now open for the Decarbonising Transport Awards, proudly sponsored by Sistra. These awards celebrate the individuals, teams, partnerships and innovations demonstrating genuine leadership and commitment to reducing carbon across the transport industry. Competition entries must be submitted by Friday, the 5th of December, and the winners will be announced during the afternoon of Friday, 27th of March at the prestigious Royal Lancaster Hotel in London. For further details, please visit the competition website now displayed on your screen, and we'll post links to the chat so you can sort of access this after the event. So we've got four excellent varied speakers today. Firstly, we'll be hearing from Peter Jones, Professor of Transport and Sustainable Development at University College London and the Healthy Low Carbon Transport Hub. Secondly, we'll be hearing from Nicola Lodge, who's the co-author of Vision-Led Planning, How to Plan Development and Transport Infrastructure More Sustainably, and she's an associate with Integrated Transport Planning. We'll then hear from Alan Wong, who's an associate lecturer at University of Southampton and the Transportation Research Group. We'll then hear from Roger Gethin, who's the joint coordinator of Low Traffic Future. So proves for a really interesting and varied panel. So just a few housekeeping. If I can ask for any questions to be posted in the Q&A box, with the chat function only being used to speak to other attendees at this event. Just to flag this, the chat function won't be monitored. We'll be monitoring questions that come in via the Q&A box. So firstly, I will hand over to Peter Jones, who is going to deliver his thoughts on successful delivery of visions through collaboration and consensus building. So I'll pass over to you, Peter.
Thanks very much, Emma, and good morning, everybody. Have the first slide, please. As in the next one, yeah. So what is the challenge? Well, government at all levels, national down to local, is committed to delivering more healthy and livable environments, while at the same time reducing carbon emissions and also tackling transport poverty. And we can see this being articulated in the vision set out in many local authorities' LTPs, with land use planning being seen as part of the solution in the longer term. At the same time, reduction in car use is also part of the mix, but we're finding increasingly this can trigger a strong backlash and lead to polarization and populism. So what can we do? What's happening and what can we do about it? Next, please. Well, clearly people need to travel to access everyday and specialist goods and services. And if we look beyond the land use itself to actually how these goods and services are provided, they're done so by a range of public and private sector organisations, albeit health, retail, entertainment, education. With the way that these organisations organise their delivery, that has major consequences for when, where, how often people need to travel. And historically, if we look back, we can see that the way that these organisations have reorganised their services has often led to longer and more remote trip locations, to centralised places or out-of-town services, and associated with remote housing schemes, all increasing reliance on cars. Next. But this doesn't only have the obvious implications for negative effects on travel in terms of congestion, pollution, collisions, etc. It also has wider negative impacts. So because the way in which health and education services are provided, they may require large transport budgets to enable children and patients to get to from people's homes to schools and health facilities. We know that difficulty in people accessing healthcare can result in no-shows at their appointments and people deferring medical support until their condition requires emergency treatment. And we know also that long school trips can reduce pupil concentration and increase truancy rates. Next, please. Now, in terms of tackling these problems and making more livable communities and so on, authorities already have many tools at their disposal. Some popular, the carrots, some less so, the sticks. Land use planning is a key one of these, but tends to be slow to be effective because of the long time period over which land use is physically changed. But we can add a new tool to the armory by looking at the service providers and getting them to think about how they can rearrange their delivery patterns so they locate services closer to customers or clients, reduce the necessary frequency of visits to sites, make greater use of the web access to get to their services. And much of this can be done in the short term by more use of the web and repurposing existing building stock. It's not always dependent on long-term land use change. Next, please. So I'm going to give you a few practical examples from the health and social care sector in the UK. Next, please. First of all, an example from Greater Manchester, where in order to receive a treatment for macular degeneration, patients had to travel to the main hospital in the centre of Greater Manchester. A while back, they introduced 3 satellite centres as well, the 3 shown in blue. And as a result of that, that led to a 50% drop in mileage necessary to receive treatment and a modal shift from car to more people being able to walk or cycle there or make use of local bus services, and also an increase in attendance rates as well. Next, please. Also, if we look at mental health, which is something that's growing in importance now, since COVID, there's been higher levels of mental health problems among young people. In one case in Blackpool area, a specialist regional centre was set up, but they found that one of the towns in the catchment area had low attendance. And when they looked into this, they found that it was the cost of bus fares for the parent and the child was the main reason that people didn't attend appointments. So they provided a local clinic in that centre, and that resulted in a large reduction in no-shows, more people coming along and seeking support, and emergency hospital admissions for mental health problems reducing by nearly 50%. Next, please. Another example is bringing care back to the high street. Over time, healthcare has become concentrated in fewer larger centres, often with poor access except by car. Now there's a focus on localisation, providing healthcare in empty shops on the high street in a much more accessible location, which people visit anyway on a day-to-day basis. And the impacts have been greater than expected. Many more people have just popped in to seek medical help, especially poorer people, rather than having to make an appointment to see a doctor. And where there were appointments, much lower rates of no-shows. Next, please. And now, recently, a new NHS strategy has been announced, which has 3 key shifts that will also support improved access to healthcare. First of all, hospital to community, the idea of localising care provision, for example, on the high street, resulting in shorter trips, more scope for active travel. From sickness to prevention, again, over time, that will lead to fewer health-related trips, and prevention will also include encouraging people to be more active in their communities and travelling locally. And analog to digital, the idea of being able to do more things online, and so less need for physical travel. Next, please. And the last example about on the social care side, looking at home care reorganisation in Wigan. before a reorganisation came about because the local authority was finding it difficult to recruit young carers. And the main reason was there were a whole number of service providers, and you randomly allocated to households all over the borough. And you can see that by the whole mix of different colours on the left-hand side. And that meant that most carers had to have a car and driving licence to be able to do the job. They reorganised the care provision in the borough by reducing the number of providers and giving them each a local catchment area, as you can see by the clustering of colour on the right-hand side. Now, that solved the recruitment problem, but it had many other benefits. Shorter trips led to clearly much less need for car use. It meant that they could spend relatively more time with patients and could arrive on time reliably, less stressed. They weren't stuck in congestion trying to find a parking space. And also the job became more rewarding because carers had more contact with the local community, among which they were highly prized. Next, please. At the conference, Landed conference last week on transport and health down in Bristol, there was a lot of discussion about the effectively dysfunctional dialogues that are tending to happen now, particularly in relation to pro and anti-car views, becoming much more entrenched, partly due to social media creating bubbles and therefore people talking to like-minded groups. And what we find is complex problems or solutions are simply treated as black and white issues. For example, local traffic neighbourhoods. They're either good or they're bad, whereas in reality, some work very well, some work less so, and we could learn lessons from that. I think the conclusion was that we need to respect and listen more closely to different views, to look behind the words and to understand people's underlying concerns, where often there are genuine issues that should be addressed. For example, the impact of traffic restrictions on businesses is very much context specific. People can point to LTNs where businesses have flourished. People can point to LTNs or surrounding roads where business have suffered. And it comes down to the type of business, the catchment area of the customers, whether they need to move bulky goods and so on. So I think we need a much more nuanced discussion there. Next, please. So finally, I think we need a twin track approach to addressing these issues. Working with the providers of goods and services can result in redesigns that reduce inaccessibility and inequity, cut air pollution, reduce road collisions and carbon, and facilitate more use of active travel, both as full trips and as access to improved public transport modes. Being in a situation where you need to travel less, either shorter trips or fewer trips, with more opportunities to walk and cycle, is very different to being told that car driving is bad. And for example, a politician, telling somebody they shouldn't be driving 20 miles to a hospital doesn't go down very well. If the NHS says, look, we can provide what you need 2 miles away, not many people are going to complain that they can't drive 20 miles anymore. So it's a whole question of framing and providing benefits for all. So let's put an emphasis on developing and applying techniques and framings that move us from dysfunctional to functional debates. Thank you. Next. Yeah, thank you.
Thank you very much, Peter. Some really interesting points I found there on sort of demand management and how localising health services has had a real shift on mode share from the private car, and some really positive health impacts on the ground. So very interesting case studies provided there. So I will now move on to Nicola Lodge, who is going to talk to us today about vision-led transport and delivering healthy outcomes. Thank you, Nicola.
Thanks, Emma. So yeah, next slide, and then the next one again. Thank you. I won't dwell on this too long. It's just essentially describing what I'll talk about today. And yeah, I've already been introduced as the co-author of that vision-led planning guidelines report, which was aiming to be sort of a simple and kind of practical way to apply some of the thinking that I'm sure we're going to be talking about today in real life, like in the planning system and in transport assessments. It's also worth mentioning that I'm vice chair of the National Fixing Transport Assessments Working Group as well. And we've been trying to lobby the Department for Transport to make changes or they are making changes, to incorporate certain changes into their new transport planning guidance. And the screenshot there is just pointing out that part of that lobbying has been about trying to encourage transport assessments, as in those that are submitted to support planning applications, for those to specifically address health impacts and health outcomes and health benefits of new development, new transport systems. So next slide, please. And again. So this, I've said what is the problem, and that's sort of in quotation marks. And I think a lot of us are already moving away from this problem quite nicely. So it's more, what have we been doing for a long time, and how might we change that, or how are we currently changing that? And I would characterize what we've been doing in transport assessments for new development as being what's comfortable. For a long time, we have all been kind of following a similar approach for many decades, and that flowchart on the right hand side is me trying to sum up what we all call predict and provide way of approaching assessment. So we very often think about we very often get given a group of sites which are all deliverable or feasible. Landowners have put them forward, and they become the sites that development is located on for one reason or another, and often not quite the right reasons. Then quite often we've jumped to basically how many vehicles will this site generate, and that becomes the crux of an assessment. And very often we're focusing there on the peak hour and the trip generation during that peak hour and what those impacts will be. Because of that, and because of the data we use to evidence it, we end up in quite a car and highway focused set of tests, set of results, and set of metrics against which we measure against. And if we imagine a place, or if we base our entire assessment around cars and car dependency, then obviously it is quite likely that then we base our sort of strategy and our mitigation approach around mitigating the highway impacts, reducing queuing, reducing congestion, reducing delay, etc. And in my view, that's how we're ending up in this cycle where we've been perpetuating kind of car dependency, vehicle demand, congestion, delay, or at least perceptions of those for quite a long time. The next slide, please. And then this is quite an important one. We're thinking about the relationships between transport and health and kind of society and social cohesion and the environment. So who gets left behind in that approach? Well, as I said, we have very often focused on a peak hour assessment. Peak hours are when a lot of people, but not all people, travel to work. And we very often support those kind of assessments with things like census travel to work data. And the graph on the left-hand side is from the National Travel Survey last year, and it highlights that across a day, only 12% of the trips that are made are actually commuting based. So we end up with assessments which are really only, or a lot of them are focusing around those commuting trips and facilitating those. And actually you've got a large number of trips for a lot of different journey purposes that happen throughout the rest of the day that can be ignored if we're not careful. And then the graph on the right is highlighting, it's again from the National Travel Survey, that often commuting trips are the longest of trips being made. Lots of other trips are a lot shorter. Commuting trips are often, because of the nature, although this is a problem in itself, tending to be more car dependent. They're tending to be longer distance, so people drive more. Maybe there's some public transport in there. But by focusing on those, we're not really focusing on all of the other ways in which people travel and accommodating those. And so our focus on our funding isn't necessarily being funneled towards the right kind of trips and the right kind of infrastructure to support those. And thinking about active travel and healthy travel, just going for a walk, which is the shortest type of trip being made on that graph, feels just as important to facilitate as a commuting trip. And yet you deliver very different infrastructure to support that. Next slide, please. And then these are sort of all of the more perhaps indirect, perhaps direct exogenous outcomes that come from this predict and provide and car dependent way of planning in the planning system. Which I don't need to run through in detail, but obviously we're not just talking about healthy active travel when we're talking about health outcomes. It also relates to air quality, noise pollution, social isolation, mental health and well-being, the way that places make people feel and whether they feel happy in them, and the way in which that relates to public finances and how we fund things. Next slide, please. So a bit more positively then, why vision-led? And I've got a couple of images just to illustrate this. So the image on the left and the image on the right, if you compare the two, which of these looks familiar? I think I know what most people would say, but then it's a very different answer when I ask you which do you prefer. And if you click one more time, Deval, these are actually artistic impressions from a project with the Royal College of Arts that ITP did. And they're titled as Dystopia and Utopia, but I would argue that the dystopia on the left is actually pretty similar to the type of thing that we do see every day in our towns and city centres at the moment. The one on the right seems completely out of our reach. We don't really see that in the UK very often. And so this slide is really just me saying, anything that we can do to get away from that image on the left surely has to be better. We don't know exactly what that might look like yet. We await new guidance. We're having to come up with maybe our own methodologies, our own ways of doing things in transport assessment. But it's almost impossible to do anything which is worse than the image on the left. So I think just trying new things, taking a bit of a leap of faith and being optimistic about our planning system and how we approach transport assessment should lead us a little bit more towards the image on the right, and that has to be better. Next slide, please. And so what does vision-led look like in practice? Sort of a similar flowchart to the predict and provide one, but a little bit different. And this is actually credit to Peter Jones as sort of a visualization or my interpretation of what vision and validate looks like, which was coined by Peter. It's a more holistic approach, more iterative. It challenges us to stress test things and iterate them more, and also monitor and manage them. And it starts with a vision which I think necessarily isn't so transport focused in isolation or in a vacuum. Very rarely when you ask people what do they want out of a new place, a new development, do they talk about actually wanting to be able to drive from A to B or wanting to be able to park their car. They want somewhere that makes them happy, healthy, that feels like a good quality place, that is sustainable. Only then should we be thinking about, well, how does transport relate to this, and how can we help in our transport assessments to measure that kind of metric and measure that kind of outcome and deliver that kind of place. So next slide, please. And I've just got one example of how we have applied that in practice in a project. So I won't tell you where it is, but this is a real project that ITP have worked on. And from the outset, we just we said to ourselves, we will do this in a vision-led way, in the way in which I described on the previous slide. It's an existing town with proposals for a very large urban extension, kind of doubling the size of the town. So naturally, there are going to be more trips on the network, perhaps a lot more vehicle trips. And there's a decision point there. How do you deal with those vehicle trips? Do you continue in that perpetual cycle of predicting more vehicle trips, measuring the peak hour, accommodating commuting, and therefore essentially increasing the highway capacity and the junctions around the town? Or do we start by saying, what if there was more opportunity to travel sustainably? Who would use that infrastructure that we're delivering, and how might that shift the dial in terms of how we're measuring the trips, assessing them, predicting them, and what kind of metrics might we want to look at in the transport assessment? So next slide, please. So what we did is actually nothing wild, but we just said, what if we think about daily trips and measure those? What if we think a little bit harder about how many people's journeys might be contained within the sites rather than externalized onto the external road network? And just by slightly changing the data sources that we're looking at, so not focusing solely on census, not focusing solely on external vehicle trips that Trix tells us will be generated, you can report different metrics. None of these are, like I say, using data which is wildly different from anything we're currently using, but we're just focusing in on different metrics that are coming out of that data. And this tells a different story, which I think can then become quite compelling when you're putting this planning application in front of developers, in front of highway authorities, in front of the public. We can demonstrate that compared to the conventional assumption that everyone in the peak hour will drive and that's what we need to focus on, instead we've said throughout a day, compared with that assumption, actually fewer people will drive them than you might have thought would. Fewer people will leave the site. there will be carbon emission savings by thinking about it in this way. We can quantify active travel trips by thinking about it in this way, and we can compare that against the daily vehicle trips that are being made. And then there's a couple of suggested alternative metrics that maybe we'd put into a transport assessment instead of that final chapter, focusing in on which junctions need improving because of congestion. So, what if we challenged developers and highway authorities to measure success by how many kilometres of new cycle route are being delivered through a site, or how many more trips to school are safer, that sort of thing, or how many trips can be contained within a large-scale development. This has led us to focus the kind of investment, the developer contributions, Section 106 contributions, on a different set of things than you might conventionally expect. And therefore, like I said earlier on, that's something different, and anything probably is better than focusing all of that money on improving the strategic road network junctions that are near to the site, for example. So next slide, please. And again. So these are just closing thoughts, which I won't dwell on too long. This is sort of my visualization, firstly, of that predict and provide cycle that I think maybe we've been stuck in for a while. And kind of jumping onto it at any point, it feels quite recognizable, I think. So as I've said, we have been planning new places to accommodate the car. And this has guided the way in which our policies and guidance have looked for quite some time, albeit that's now changed. By providing for the car and for people to move around in the peak hours by car, we can mistake a lack of choice for a lack of demand, and that gets us stuck in a cycle of spending, like modeling the wrong things, spending money on the wrong things, measuring the wrong metrics, and we end up in the same place again. Whereas, next slide, please. The virtuous circle looks similar but has different outcomes. If we think about the daily trips that everyday people are making, shorter distance, for different purposes, then we pick up on the different requirements and needs of those people. We might still use a model, but we'd use it judiciously, and it gives us different outcomes. And then perhaps we focus our investment on different things, or at least we better balance out where our investment's being spent to deliver genuine travel choice. And that should feed into our future planning policies and standards, etc. And repeat the cycle again in a much more positive way. And that's it.
Excellent. Thank you very much, Nicola. Some really interesting thoughts on how we can put vision-led planning really into practice through those examples you've shared, and the importance of us all doing so in order to get us out of this vicious cycle of car dependency. So thank you for that. I will hand over to Dr. Alan Wong, who is going to talk to us through some of the delivery challenges associated with prioritising health in transport and planning policies. Thank you, Alan.
Thank you, Nicola. Emma. Good morning. I'm Dr. Alan Wong, applied research scientist at the University of Southampton, and I've been asked to share some insights as to why prioritising health in transport and urban planning should be a win-win for everyone. However, this is often harder to deliver and communicate than we imagine. And I will illustrate this through a case study and also touch on what we might be able to do about it. Next slide. A quick summary of what I'm going to cover, essentially why prioritizing health in transport and planning is important, talk about the example case study and some of the challenges in presenting transport evidence, then touch on how greater devolution could help, along with emerging research that may also inform this space. Next, please. So why is prioritizing health in transport and planning important? The next few slides are essentially a quick summary of the lectures I give to students on our master's program for transport and the environment. Today, transport forms an essential part of our daily lives for the movement of people as well as cargo, and as you should all know, land use and transport planning go hand in hand. But is it a necessary evil, given we know it has impacts on soil pollution, air quality, water pollution, noise pollution, as well as on global warming and climate change?
Apologies to come in, Alan. I'm just getting a little bit of background noise, so I'll let you know if it becomes sort of inaudible, but just to make you aware,
I talk a bit louder. Apologies, my mic isn't so strong.
Thanks, Alan.
Next slide. This is particularly for road transport, which is associated with a whole cocktail of harmful air pollutants from transport exhaust emissions. NOx and PM, or particulate matter, are perhaps the most significant currently, although historically, we've also focused on lead in the last century, and then CO2 and associated climate change at the start of this century, which of course is still very much relevant to global warming, as is SO2 or sulfur dioxide, as well as ozone. NOx is a generic term for the oxides of nitrogen consisting of nitric oxide, or NO, also known as nitrogen monoxide, and nitrogen dioxide, or NO2. NO is a colorless toxic gas, which also converts easily to NO2 in high concentrations or when combined with ozone, which can also be emitted from combustion engines. Nitrogen dioxide itself, it's a nasty smelling gas, which can dissolve in water to form nitric acid, which is very harmful and corrosive. You can also get N2O, or nitrous oxide, that's laughing gas to you and I, from diesel engines, principally due to the catalytic converter reduction, but air pollution is really no laughing matter. Increasingly, there is also a focus on polycyclic aromatic hydrocarbons, or PAHs, and volatile organic compounds, or VOCs, which are now also proving to be very, very harmful for humans. Essentially, these are all products of unburnt fuel from internal combustion engines, and pretty much all the emitted substances, including water, are pollutants that harm the atmosphere and are toxic to humans. Water contributes also to global warming. So the overall message is that the use of cars and other road transport are generally a bad thing, even if some people consider it a necessary evil. Next slide, please. There are also other sources of emissions, including vapors from fuel, brake, and tire wear, as well as power generation and from interchanges and terminals. Most important to note is that the conversion to electric vehicles in themselves will not solve the air pollution problem from road transport. Really, a reduction in demand or move to sustainable modes of transport is needed. In addition, it's estimated some 5 to 10% of all the plastics found in our oceans can be attributed to wear and tear from tires, and I've given you the source for this. Indeed, the contribution from car tires is said to be substantially higher than those of other sources of microplastics, and it also contributes to something like 3 to 7% of all the particulate matter in our atmosphere. There's also the problem of noise pollution, which can be a major problem in our cities and can lead to early deaths and or morbidity. Next slide, please. This slide is really just to give you some concrete examples of the harm caused by transport, and particularly motorized vehicles. I'm not going to run through it in detail, apart from to say both air and noise pollution contribute to substantial morbidity or early deaths in people, not dissimilar to how smoking causes many different types of cancer that kill people early. And there is significant clinical medical evidence to support this, because the impact is very high if you look at the numbers. This is because typically over 20% of all PM2.5 and over 31% of all NO2 emitted in the UK comes from road transport. That's about a fifth and a third, respectively, of all air pollutants. So both air and noise pollution from motorized vehicles are a major problem for public health. Next slide, please. So if the move away from motorized vehicles is generally a good thing for public health, why is it still difficult to promote more sustainable transport schemes? Well, one of the key reasons is decarbonization and reducing the emissions from transport have not really considered the public and mental health impacts on people. For example, suggestions to replace the petrol diesel cars at the end of the last century, in fact, led to poorer air quality and health outcomes in our cities, with increases in NOx. While the potential health benefits of some forms of low carbon transport, such as increasing physical activity and cleaner air, are now beyond doubt, the health and well-being benefits are often difficult or more or less clearly evidenced. Indeed, some forms of low carbon travel are now being promoted without really full considering the health implications. For example, increased particulate emissions from tire and road wear and the increased weight and acceleration of electric vehicles can lead to more severe pollution consequences for our vulnerable road users, not to mention the heavy metals used in batteries for electric vehicles are harmful for the environment. Attempts by planners, engineers, public health experts, and government to promote health beneficial forms of transport have also met with mixed success, as Peter has referred to earlier. Next, please. Which brings us to an interesting case study of the Portswood Busgate in Southampton. This was a trial scheme started earlier this year in Portswood, which is the northwest suburb of the city near the university. The aim was to improve public transport to and through Portswood, to encourage greater sustainable travel and create a more vibrant and walkable neighborhood by closing the main Broadway to cars and vans in essence during a 3-hour window in both the morning and evening peak from Monday to Saturday, which was monitored using typical transport measures like loop detectors, traffic counts, and also vivacity cameras. Despite initial support for the scheme and some positive funding made by the consultants who consulted the initial evaluation, the trial was abandoned in May due to fairly vocal local opposition. Next slide, please. The transport evidence, they show generally healthy trends. For example, with both car and van traffic decreasing during the scheme operation from 7 to 10 a.m. and 4 to 7 p.m., while there was a corresponding increase in pedestrian access. In fact, there was also an increase in people walking along the Broadway, even outside the scheme periods, from 10 a.m. to 4 p.m. or during the interpeak. Cycling traffic on the right appeared to be similar, but actually a deeper dive showed more cyclists were actually traveling on the road rather than on the pavement. Van traffic, the second graph on the left, also reduced during the interpeak, but this could have resulted in greater displacement onto local roads, which is perhaps difficult to foresee as a consequence, because logistics deliveries typically operate on a tour or delivery route basis, so diverting from one road might change the whole delivery pattern and perhaps result in more LGVs, MGVs traffic on other roads, which local residents might not typically see otherwise and might give them further cause for complaints. Nonetheless, traffic displacement onto local roads are a major concern of the local community. Next slide, please. I wasn't going to show this slide originally, but when I explained to a colleague at the university who lived in the area that bus punctuality generally increased due to the busgate, she wouldn't believe it and pointed to a case of her daughter being caught on a U1 Unilink bus being held up longer while traveling south one weekday around 5 p.m. after school. This is really interesting because the data seems to support this. Click, please. But the overall point is lost. That actually, if you look at the whole picture, punctuality improved overall, including during the interpeak when the scheme wasn't operating. Next, please. This show is that all it takes is for one commentary or social media post of bus delays and traffic congestion created on displaced roads to create a perception that is perhaps not the full evidence, but more anecdotal, as we would say in academic terms. Although there was undoubtedly displacement onto local roads, which the evidence also shows, there are many more reasons why it's often challenging to present the case for healthy or sustainable transport schemes. And I give more reasons and examples here, which many of you will already be familiar with, in particular with the amorphous nature of specific transport schemes rather than at a higher level, as well as the difficulties in collecting hard data, which is relevant or representative of the schemes. Also, as Peter's already referred to, the increasing influence of social media shouldn't be underestimated, especially in terms of the political influence. It takes a stronger leader to really advocate many schemes in the face of opposition from people who use their cars, which, as I said, is a necessary evil. Next, please. Which brings us to how greater planning and devolution could potentially help, in particular with stronger powers given to regional or combined mayoral authorities, as well as the ability to provide wider messaging. Now, I'm not an expert on devolution, This is really the domain of local authorities, and I know they're assessing the impacts as we speak, but I'll try to give you some of the main benefits listed here. Next slide, please. Many of the measures that can help promote or deliver sustainable transport schemes have or will be discussed by others on this panel. But I just wanted to highlight one more, including the Healthy Low Carbon Transport Hub, which I am leading as a co-investigator along with Peter. One of the things we have discussed already is the greater need for community engagement and messaging, although this is often easier said than done. It's only now that researchers and practitioners and policymakers are starting to get to grips with defining, quantifying, and showing how we evaluate the public health outcomes from transport schemes, which I said historically tended to use proxies, for example, the DFT's emissions factors toolkit. Only by engaging the public in more robust and meaningful conversations about what sustainable transport means for them and could deliver for them, rather than just the perceptions and only transport data, will we really start to push forward the healthy transport agenda. But there are some encouraging examples of this now. For example, the case of school streets, which are healthier for our children, and this message is starting to get through. Next slide. Thank you very much.
Thank you very much, Alan. That was really interesting. I think what really resonated with me is the importance of ensuring we capture wider health benefits, including sort of physical and mental health benefits in any sort of monitoring and evaluation of transport schemes. And also the importance of sort of balancing the perception of schemes. So that social media influence you mentioned, the importance of bringing the community along the journey of in sort of interpreting the impacts of transport schemes, which was also sort of a key theme that Peter brought up in his presentation. So there's clear sort of synergies across the speakers' views in terms of the importance of community engagement. So thank you for that. I will now hand it over to Roger Gethin to talk us through devolution and planning reforms and the opportunities for healthy transport. Thank you, Roger.
Good. Thank you very much, Emma, and thanks for inviting me. On to my introductory slide. That's my title. I will be talking about the government's plans, how the government's plans for devolution. There's devolution legislation and planning legislation and indeed bus legislation, and they all intersect. And I'm going to talk about how these could create opportunities to overcome some of the difficulties of getting local developments, particularly new homes, to be in the right, the right kind of homes in the right kind of places. This is a phrase that politicians use all the time, and yet we've not been doing it. So I'm just going to explore how the government's proposed changes could lower at least one of those barriers to getting this stuff right. Moving on. So just to introduce Low Traffic Future, we're an alliance. We're hosted by the Transport Action Network. We bring together a range of health groups, environmental groups, sustainable transport groups, road safety groups, around this shared vision of a world where fewer journeys need to be made by car, van, or lorry, so we all benefit from cleaner air, safer streets, and all that good stuff. We're about building support for all that, for that agenda. And the next slide shows the various members. Just moving on. So you can see we've got road safety groups like Break and Action Vision Zero, environmental groups, Friends of the Earth, Greenpeace, CPRE, sustainable transport groups like Living Streets and My Former Employer, Cycling UK, well, yes, so a range of interests, but with a shared vision of less car dependence. Next one. So that outlines our vision, and that AI graphic at the top is rather similar in spirit to the one that Nicola showed earlier. We're talking about aiming for a 20% reduction in motor vehicle traffic on our roads, because we've got good active travel, fast, frequent integrated public transport, and so on, sustainable freight, demand management, including various forms of road pricing in rural as well as urban areas. We've produced a guide to what we think should be in a good local transport plan. There's a link there at the bottom, which I hope Juliana is about to post in the chat. So that's what we stand for in terms of transport policy locally, more generally. Moving on to the next one. What does this mean in terms of new development? So we've had this concept of low traffic homes, and this is very much in line with what other speakers have talked about, where for key things that about low traffic homes, there'd be places where everything's close together. That means building to moderately high densities. So instead of 2-story homes with plenty of car parking space outside, we build, 4, 6-story buildings with courtyards, attractive shared spaces, which will enable people to get around more easily by walking and cycling because everything is closer together. The streets are safer. People are less dependent on cars because they're clustered around public transport. That means the public transport itself is more economically viable because there's more demand for it, so it works better. That reduces dependence on cars. That is another version of the sort of the positive cycle that Emma showed earlier. That's what we stand for. Moving on. So what is it that the government are doing that will enable that vision to be realized more easily? Well, let's start with where are we at the moment, and this will be very familiar to many of you here, but it's probably worth setting it out because I hope this helps explain what's going to change. So at the moment, we have combined authorities or combined county authorities. I'll touch on them in a moment, but the distinction is not that important because it will disappear in time. So places, they've mainly been set up in large urban areas, Greater Manchester, West Midlands, and so on, but they're beginning to spread, and the government wants to spread them all over England, to everywhere in England apart from Greater London. We'll come to that in a sec. But those combined authorities or combined county authorities, they're local transport authorities. So that means they're responsible for writing a local transport plan and for overseeing local transport services, mostly buses, but in places like Greater Manchester and South Yorkshire, it also means trams. They are not, however, although they are local transport authorities, they are not local highway or local traffic authorities. To explain what they are, let's step out of the combined authority area into the typical structure that many of you will be familiar with, what are county councils and district councils. Now, where you've got that structure of a county within which there are a number of districts, the county will be the local transport authority for the time being. It will also be a local highway and a local traffic authority. Now, local highway and traffic authorities are always the same body, but they are legally distinct roles. The local highway authority role is about providing local highways, managing them, maintaining them. The local traffic authority role is about managing the traffic, regulating that, deciding the speed limits, the one-way streets, the bus and cycle lanes, the vehicle access restrictions, the parking restrictions, and so on. That's the local traffic authority role. Within a county council, there'll be a number of districts, which are local planning authorities. So they draw up a local plan, which decides where development is meant to go and where they will or will not grant planning permission. Now, in some parts of England, we have unitary authorities. There are sometimes complete counties such as Cornwall or Herefordshire that have got rid of their districts, or they can be cities or smaller towns like Southend that have effectively become split off from their parent counties. Those unitary authorities cover all of these roles: the local transport role, the highway and traffic role, and the planning role. Now, when going back to combined authority areas, the constituent authorities, typically boroughs or unitary authorities, will be both highway and traffic authorities and planning authorities, but they're not transport authorities. Just to touch on that distinction between combined county authorities and regular combined authorities, a combined county authority is one such as the East Midlands Combined Authority that contains within it the traditional authorities with that traditional split that I touched on earlier, a county within which there are districts. So within the East Midlands Combined Authority, you've got Nottinghamshire and its districts, and you've got Derbyshire and its districts. So at the moment, you've actually got 3 tiers of authority. You've got the Combined Authority, which is the Transport Authority. You've got the counties, which are highway and traffic authorities, and then you've got the districts, which are planning. It's a mess. So moving to the next one, the government is proposing to simplify this and have effectively a one-size-fits-all model for the whole of England. London isn't included in this restructuring because it already fits this model, but we're under different legislation. So what will happen is that the combined authorities will all become what will be termed strategic authorities. They'll be responsible for writing a local growth plan. And this is the relevant bit. They will also become strategic planning authorities, responsible for writing a spatial development strategy. So a spatial development strategy will effectively be a high-level planning policy document. It won't deal with anything site-specific, and they won't take individual planning decisions, but it will set the overall planning framework. Then, within each combined authority area, so I should have said, Alan gave an example of how a Hampshire and Solent authority is going to be absorbing Hampshire County, Portsmouth and Southampton districts, and probably also the High Isle of Wight. So within those combined authority areas, there will then be only one level of constituent authority within that area, which will, so that the distinction between counties and districts will be abolished. There will be one level of authority beneath the combined authority, and that tier will combine the roles of highway authority and highway and traffic authority and planning authorities. So, having explained all that, and I hope that didn't just go by in a blizzard, what does it all mean? In effect, what we're going to end up with is these combined authorities or combined county authorities will be responsible for both a local transport plan, so strategic transport planning, and for that spatial development strategy, i.e. the strategic policies for both transport and land use planning, united in one tier of government. Hallelujah, it is something that people have been calling for a very long time, to have transport and planning at the same level instead of this split thing that we've got, particularly where we've got counties and districts. Then, at that lower tier, the constituent authorities, boroughs or whatever, will have the highway and traffic role and the planning role. So they will be responsible for the more localized version of both transport planning and land use planning. Again, joining up the responsibilities both at the strategic level with the combined authority and then at the more local level with these constituent authorities. So this is a real opportunity to join up transport and land use at both levels. One last point about the government. What's changing. There'll be three effectively levels of strategic authority, depending on whether the strategic authority decides to have a mayor and whether the mayor has been around for a long time. If they haven't got a mayor, they will have their hands tied. If they have got a mayor and the mayor's been around for a long time, they will get a lot of freedom. They will basically get an integrated settlement, i.e. some non-ring fence funding to spend as they see fit, but they will be expected to deliver an agreed set of outcomes, an outcome framework. So there are a number of other changes. Next slide, please. I'll rattle through these. They will the mayors who will control who are expected to control combined authorities will also be able to issue mayoral development orders that will strengthen their planning powers, and that the remit of mayoral development corporations will expand so that they can set up new towns. It's clear how this is related to the government's agenda to the aspiration to deliver 1.5 million homes over the course of this parliament. These combined authorities will also be able to raise a transport levy to effectively get the local authorities to collect some funding to deliver transport services through the process of collecting the local charges. They will be able to designate a key route network over which they will have powers over direction over the constituent authorities, so they'll be able to get their way on the most important roads. They'll be required to report on traffic levels on that key route network, and they will be required to consider setting traffic reduction targets for those roads. They'll have civil enforcement powers for traffic offences, so they'll be able to take action on parking infringements, bus lane infringements, and so on. And they will have the power to regulate micromobility schemes. They will also, as I said, there's also some bus legislation will give all of these local transport authorities greater powers over buses in the same way that Greater Manchester already does. So moving on to what can local authorities do? Well, firstly, there are some risks in this structure. This is my final slide. There are some risks in this structure that expanding the geography of transport planning could mean that strategic planning gets greater priority over more localized planning, such as active travel. That is one risk. There is also a risk of political paralysis, particularly in those foundational authorities, where I said if the combined authority, if the constituent authorities don't agree to have a mayor, there will be less power for the combined authority, and there is a risk of political paralysis with nobody agreeing. There is also this risk that the mayoral development corporations I mentioned may lack political accountability. But let's now come to the positives. Let's end on the positive note. What are the opportunities here? The first one is that it will create the opportunity to overcome to end this current system whereby every district council, every little district council gets a housing target from central government, regardless of what public transport or what brownfield land it's got. In other words, basically, regardless of its ability to accommodate, sustain homes in the right homes in the right places. That will end with basically housing being allocated to the strategic authorities that will be able to concentrate their housing in the larger urban areas and build transport systems so that the two are integrated. This is fantastic news. They will be able to effectively be able to plan for transit-orientated development, high densities, and this idea of proximity principle. So having everything close together so that it's easy to get around and walking and cycling, so that there's high demand for public transport. They will be able to use the government's recently launched connectivity tool, which provides local authorities with data on whether a proposed location is close to, whether a proposed housing location is close to schools and shops and public transport and so on. And therefore will be opportunities to prioritize locations with high connectivity scores. That outcome framework that I talked about, there'll be an opportunity to say it really needs to include indicators for less motor vehicle traffic and for better health outcomes and indeed for better climate outcomes. So that is a real opportunity. And then to make sure that the local transport plans and spatial development strategies set out the policies to achieve those outcomes. The last one I want to touch on is this idea of targets or indicators in local transport plans for proximity. I saw an amazing example of this in the local transport plan for West Northamptonshire. They have set an indicator for the proportion of homes that are within either 400 metres or 800 metres of public transport or within 1500 metres of rail. That principle could be applied not just for proximity to public transport, but for other things too. So please do use the connectivity tool and the idea of a proximity indicators if you have any influence on your local transport plan. I'll leave that thought and thank you very much.
Thank you very much, Roger. I think some really engaging points on sort of linking housing density, connectivity, and the proximity principle, and how this, how the planning reform identifies some threats and opportunities. And I'm sure this will be a topic that is no doubt discussed quite extensively in our panel debate. So just before we move further on into the panel discussion, I'd just like to mention again, for those who may have joined us late and missed the earlier announcement at the start of the webinar, just wanted to add that entries are now open for the Decarbonising Transport Awards, proudly sponsored by Sistra. So these awards celebrate individuals, teams, partnerships and innovations demonstrating genuine leadership and commitment to reducing carbon across the transport industry. So competition entries must be submitted by the 5th of December, and we've submitted links in the chat to the website where you're able to submit your submissions. So the winners will be announced during the afternoon of 27th of March next year at the prestigious Royal Lancaster Hotel in London, and we've submitted the link so you can find further information on that via the links in the chat. So thank you very much to our range of speakers. We've had some really interesting presentations there, and I can see there's a number of sort of very insightful questions that have been posted in the Q&A. So we'll move on to our panel debate. So if there's questions that people feel as we move through the panel, please continue to post these in the Q&A, and we'll pick up accordingly as we move through this session. So my first question, and I think I will direct this to you, Roger, and then we'll open the floor to other speakers to come in and answer. So how will the increased powers given to leaders and mayors in the English Devolution and Community Empowerment Bill enable the unlocking of transport in their regions? What specific tools, powers will it provide, and are you clear on how these could be delivered?
Yeah, well, thanks. I mean, I hope that my presentation has sort of answered quite a lot of that. The short answer is that it will give combined authorities greater powers to shape development within their region at a strategic level. And the really important bit is this aligning of transport planning and land use planning responsibilities at both the strategic level, i.e. the combined authorities or the combined county authorities, and at the more localized level. So we won't get this situation we've currently got in where there's a county and districts where they don't even necessarily know about one another's ideas. I mean, I've been very frustrated that the county authority will sometimes not know about the district authority will sometimes not know about the county council's cycling walking infrastructure plan and so on. So if they don't know about what each other are trying to do, it's very difficult to kind of make sure that things line up. This is not going to overcome all of the barriers, but it is an important barrier that will go. There are others too. There are changes that we need to make to the National Planning Policy Framework. It still contains a paragraph that makes it difficult for the local planning authority to refuse the wrong homes in the wrong places, despite some changes of wording the last time the National Planning Policy Framework was there. It still basically says it's difficult to reject planning applications on transport grounds. It needs to be much clearer that you can reject the wrong homes in the wrong places, but with at the same time a very clear incentive to approve the right homes in the right places. And as I say, the fact that the district councils will no longer get their own target disseminate from national government to deliver X number of homes, regardless of their transport systems, that is a really important step forward.
Thank you. Yeah, I think, as you say, it's definitely that it sort of increasing that communication and wider awareness and that sort of strategic thinking that will be critical here. Just another question that sort of links into that was in relation to how do we feel that the bill will impact, particularly in rural areas and national parks in particular. And so sort of it links into the same question. So how do we feel that sort of will be impacted via the bill for the multiple combined authorities and highway authorities? Thanks, Roger.
Want to make sure that I don't dominate, but yes, let me just pick that one up, because actually the point about well, firstly, the rural point, I think that this opportunity for the combined authorities to concentrate development in their urban areas will make it much easier to make sure that we don't get more and more homes overloading the road systems and basically being in places where it's impossible to provide public transport. So I think that there will be less pressure on rural road networks from new development if this goes as I hope. The point about national parks, though, is a really interesting one, because national parks are an exception to some of what I said earlier. They will continue to be planning authorities, even though the constituent authorities, however they restructure themselves, will still be the highway and the traffic authorities. So to Alan's example of Hampshire and the Solent, there will still be the New Forest National Park, will still be a planning authority, even though the whatever authority ends up replacing Hampshire, it might still be Hampshire, who knows, will still be the Traffic and Transport Authority. So how that gets resolved, I think, is remains to be seen. Exactly how local authorities draw their boundaries within each combined authority area is being left to the existing authorities in that area. So it's not entirely clear, but you're absolutely right that there is also a risk that the government, there was a newspaper report last weekend that the government is thinking of removing some of the protections for national parks, the requirement for other authorities to have regard to the national park purposes of protecting nature and improving access and enjoyment of the countryside. If that gets weakened, then we could be in for trouble in the national parks. So I think you're right to flag up that this is still an area of uncertainty.
Yeah, definitely, and I think we'll navigate that and see see how that pans out over the next few months. But just opening that out to the wider panel, is there anyone else that wants to come in on those points? Nicola?
Yeah, I'd be happy to. And at risk of being a bit more cynical than I like to be, but I think it is quite a fair question, asking about the more rural areas when we're talking about devolution and combined authorities, because there is a risk there that a combined authority, obviously the positives are that it can bring together strategic infrastructure delivery, strategic growth planning, cross-boundary thinking, but in doing that, there may be a risk that we're focusing in too much on strategic transport infrastructure and not enough on the local, the everyday. I think it relates back to a question Juliana asked in the chat as well. So I'm not sure what the solution is, but if you think about planning at the local level, that can't be left behind. And when you're combining authorities together, I think that's a risk. And it also relates to how we think about transport appraisal and business cases, that focusing in on major projects is easier sometimes. It's easier to get funding for as well. And the hyperlocal new crossing points or small sections of new cycleway, I would worry that could get left behind if we're not all careful in terms of how this works.
Just to pick up on a point from Emma. Yeah, some of the mayoral authorities, for example, Greater Manchester, have wider powers, not over just transport, but and aspects of planning, but also education, some extent social service and so on. So my point about working with the main sectors that generate travel and determine travel patterns in those mayoral authorities, they might have more influence over some of those other sectors that make this something that's easier to do.
I think that's linked into another question that's came in, Peter, in relation to how do the panel feel devolution can lead to political instability, as regional governments may have different political priorities and parties in power. Does the panel feel this can or could lead to frequent changes in policy and potential instability locally, which can negatively affect the local economy and social welfare? I'll open that up to any of our speakers if anyone wants to come in on that point.
Well, I mean, just to comment that certainly my impression in recent years is that as you get a change of minister, you can get quite strong changes in priority and policy, which affects the whole country. Whereas in a way, I think there's probably more stability in many cases at local level. I think Roger's agreeing with me on that. Despite different mayors in London, for example, over time, the policy of TfL and the primary focus hasn't changed that much, a bit more on cycling or whatever, but it's almost as though at local level, transport, I think generally is seen as more important than it is nationally. And I think probably there's a bit more stability there. I don't know if Roger wants to comment.
Yes, I mean, I think whoever asked the question, that's absolutely true that there is a risk. There's also a risk, there's still a risk that combined authorities and their constituent authorities may have different political colours, and that, as I said earlier, there is a risk of political paralysis there. But I think what both government and combined authorities need to do is to be very clear about the outcomes they want. That's exactly how to do devolution well. Is to allow local authorities to have freedom to spend their money, but to be very clear about what they expect to do with their money, and that the funding gets cut if they're not delivering their outcomes. To not be too prescriptive about, you need to spend this much money on buses, and this much money on cycling, and this much money on education, and this much money on, or all that kind of ring fencing that government tends to do. If the government instead leaves them funding to spend at their discretion, but is very clear about the outcomes, and similarly at the next tier down, that the combined authorities write their local transport plans and the strategic the strategic planning documents in ways that really make sure that the local authorities are have a very clear steer, and that is a clear steer that kind of maximizes health and climate outcomes and all those outcomes. If the outcomes are clear, from cascaded from national through combined authorities to the local government, then there is an opportunity to get the right outcomes.
Definitely, I think that sort of giving that at the local level, they recognise and understand the context of what is needed to deliver positive outcomes for their communities, and that emphasis on sort of bringing communities along throughout that journey is really critical. So yeah, certainly clear on that, Roger. So there was a question in relation to sort of getting views from developers and the views on strengthening so there was a query in relation to the panel hasn't included a developer to cover their issues and sort of points of view to try and receive a well-rounded argument. So I think we'll try and pick this up from our perspective of working with developers, and I'll sort of direct this question to Nicola in the first instance. So developers' views on strengthening the PPF could give insight in what they feel are potential downsides, such as increased development cost, reduced local flexibility, challenges in achieving balanced development, and difficulties for smaller builders. Developers have significant control over design within policy and regulatory frameworks, and their primary goal of profit often leads to a trade-off with health objectives, potentially creating and galvanizing car-dependent communities. So interested to get the panel's views, but I'll hand over to Nicola in the first instance, if that's okay.
Yeah, that's fine, thanks. Yeah, so I can't speak on behalf of developers, obviously, so it would have been interesting to have their views, but in my day job, if you like, I am a transport planning consultant, so a lot of our work is development planning with developers. And I would say that the primary objective of any developer is to get planning permission to build what they need to build, and that in turn gives them the receipts and the profit to move forward. And sort of like what I was saying about how local people might view a vision for a place. Very rarely does a developer say, my goal for this planning application is to deliver new road infrastructure. That's not what they're after. They're after getting planning permission in the kind of most efficient way possible, probably the most profitable way possible. And so actually often they end up being led by whatever the local policy says they need to do. And we have a role in that as well in terms of persuading them what's the right thing to do. Local policy, as we know, and national policy is leading us towards more genuine travel choice, less car dependency, and a developer will be led by that because that gets them the planning permission. So I think that's the first thing to say. And then secondly, one of my slides had on a sort of graph, and it was saying essentially none of this has to cost any more money. In fact, it might cost less money to deliver good places. We know that major highway infrastructure is sort of exponentially more expensive than delivering new active travel routes and often delivering new bus routes, and yet they have the same capacity to carry the same amount of people and serve the same purpose. And certainly not in any of the work we're doing are we saying that you have to deliver both sustainable focused transport infrastructure and major highway upgrades. It's actually, if you start delivering more of this one and you spend your money on that and you can demonstrate that you're accommodating the same amount of trips, if not more, then nobody should be asking you to also spend your money on all of this other highway stuff, because that's just undermining the goals that you're trying to achieve with your active and sustainable transport infrastructure. And so far we've had reasonably positive receptions with local highway authorities. when we put that argument to them, and also with developers, and we've explained why we're writing our transport assessments in that way. So I think if you have that kind of positive and policy-led approach, it can work.
Thank you, Nicola. Thank you. I'll just open that out. Any other speakers want to come in on that point? Roger?
Yes, the last year's Labour Party conference was very interesting because the government's 1.5 million homes was really dominating conversations. I think there were 50 fringe events on housing, a lot of them sponsored by developers, and it was really interesting. There was a wide range of developers. Yes, we're familiar with the volume house builders, and they have their fixed model, and it involves kind of two-story homes with parking space and traditional highway designs and all the rest of it. There are a whole load of housing developers who want to move in the direction of more of quite mission driven, who want to move in this direction. And I think it really comes down to the government needing to have confidence that if they shift in that direction, that they can still get their 1.5 million homes built. At the moment, they sort of feel, oh, we can't tell the volume house builders to change their model because otherwise we'll have a hiatus in house building. Actually, it's not necessarily true. By moving towards sort of the more higher density, urban focused sort of house building model that I've been outlining and other speakers have been outlining, you can get more homes built at the same cost as Emma was just saying. Sorry, as Holly was just saying, and crucially with fewer objections, because it generates less traffic, and takes up less of the green urban space, green space that people really value. So actually, it is potentially, although it will require the volume house builders to rethink how they deliver housing, it then has the potential to get a lot more homes built, fewer objections, and better transport systems as a result of it, which then means the sort of fewer of those external costs of how do you provide health services all over the countryside when the housing's been dispersed all over the place. So it becomes easier to do the sort of things that Peter was talking about earlier as well. So there are big savings outside of to society as a whole.
Yeah, certainly, and I feel like it's linking that into the health benefits as well. Connectivity and sort of drawing in those wider benefits too. I see, Alan, you've got your hand raised.
Yeah, well, I was going to sort of add to that. I think it is important, though, still to have existing legislation or powers for local councils to be able to sort of enforce developers to act on it. I think it was a real shame, for example, when PPG 24 was really no longer sort of mandatory. I mean, historically, that I think that's allowed local councils to more dictate what developers are able to do in their local area. And that is actually a significant benchmark historically. If we could use the noise legislation, the European Noise Directive, I think was quite powerful in being able to say, look, actually, we can't have too much traffic around a local neighborhood if that's going to create health for everyone. So I think relying, if you like, on the altruism of developers probably isn't going to necessarily lead to better, sustainable housing developments.
Thank you. And Peter?
Yeah, in my experience, limited experience as well, I mean, developers are very different in terms of their main goals. Some look very much short-term, some look very much long-term, and so on. But the ones that I've spoken to who actually want to create sustainable communities often come up against the problem of actually proposing developments that are more sustainable, rely on sustainable travel, but then the relevant committee actually saying, well, let's put the roads in just in case we need them, sort of thing, which can often hinder things. I'm sure many of you have seen it. Create Streets did a good study a year or 18 months ago in Chippenham, showing how that you could provide the same number of houses in about a third of the space or less by being slightly higher density and avoiding a lot of road building and putting that into public transport, revitalising Chippenham High Street and so on. A very good example of really what Roger's been saying, I think. And finally, I just wonder whether we should move away from house builders to community builders over time. And in doing that, essentially, probably the people selling the land won't make as much money because the developers will have to put money into some of these other things at the moment the government has to do. But if we think about building communities rather than building houses, particularly on the land use and localization of services side. I think that would be really helpful.
Thank you, Peter. And I think, yes, certainly it's trying to emphasize that point in that we should not require developers to provide both the sustainable transport infrastructure as well as the highway infrastructure, and it's trying to sort of emphasize that point that it's emphasizing on that sort of local community level and ensuring those sort of active links to local centres can be prioritised. So there's been a question in relation, links into more sort of health related impacts. So does the panel believe there is a failure to adequately quantify the costs and impacts of policy choices on health outcomes, making health related investment less attractive? Is there anyone that would like to start with this one? Peter?
I was waiting for Alan to go first, actually, on that one. But yes, the hub that Alan refers to that we're both involved in, one of the things we're looking at is how to improve TAG in terms of having a better coverage of health-related factors in the appraisal process, in terms of what we look at and how we value it. And while there's a lot there on already, it tends to focus on mortality rather than morbidity in terms of quality of life, and also is very, very weak on mental impacts of policies. And these two things, I think there's a growing body of evidence on, and I think that will rich and broaden the understanding of what the impacts of different transport policies are on the wider sense of health. And also something that's come out very clearly working with public health people is they start from very different position. They start from a position of equity, that health outcomes should be the same for all. And therefore everything starts from that base. Whereas in transport, I think there's a tendency to think about the policies and so on, and then at the end do a distributional impact thing as a sort of afterthought, rather than it being at the centre of what we do. But maybe Alan would like to add something to that.
Yeah, no, I completely agree, Peter. I think it's still very much early days, actually, sort of combining the public health people with the transport people and actually working together. In our local area, those teams have joined up a little bit more, but still at the moment, we're not quite at the stage where between the public health people and the transport people, we can actually agree on a set of indicators or metrics that we can actually use to evaluate the public health benefits of transport schemes. There are some of these indicators available, but it's just agreeing on them. For example, Peter mentioned about morbidity and early deaths. So we can quantify life years or quality of life, if you like, but actually different authorities use different metrics, and at government level, that really hasn't really been tangibilized, and the guidance isn't really there. So until we get those two bodies coming together, which hopefully devolution will help, then we can actually start to talk about, well, how do we assess the actual public health impacts of transport schemes? I've alluded to some proxies already. The connectivity tool will help. And I think Roger and Nicola both referred to some indicators we can already use. But at the moment, we're not agreed on what they might be. And until we can agree, we won't be able to establish policies to enable that. So it is a bit further down the line, but this is moving very quickly. And I hope both Peter and I can contribute to that.
Thank you, Alan. Just checking if anyone else want to come in on that point before I move to the next question. Okay. There was a question in relation to how do we feel combined authorities have better or worse opportunities to improve accessibility / inclusion for the mobility of people with protected characteristics. So it sort of brings in both themes of sort of transport, connectivity and health. So I'll open this up to sort of all our speakers and sort of who wants to take that one first. Peter?
Just to make a brief point, I think there are two aspects to this. I think one is the different elements of accessibility and treatment of vulnerable groups. So if authority has got responsibility over public transport, highways, etc., then they can look at the trip more in a whole. And secondly, if it's a wider area, then they can deal in a systematic and comprehensive way with a wider range of trips, because we've touched on active travel, and implicitly a lot of the talk around that is encouraging a shift to walking and cycling trips. But in fact, more of the walking in London is not a walking trip, it's an access or egress from a public transport mode. And therefore, if we've got wider, larger authorities, they can be looking more comprehensive at public transport access, literally onto the vehicle, but also providing safe access to bus stops and railway stations.
Thank you, Peter. Anyone else want to come in on that point? Roger's got his hand up.
Yes, I'm glad you asked about protected characteristics. It's worth bearing in mind that protected characteristics, people immediately think about disability, and actually protected characteristics covers a multitude of issues, including age, sex, sexuality, and so on. So clearly there are opportunities. I've gone for that, but because I want to start with children, and children so often get forgotten in transport planning and policy debates. So I think that everything I've said about the opportunities to create more walkable, more cyclable, more public transport accessible environments helps children. It helps anybody who is dependent on not being able to drive. Now, if I come back to disability is it can cut both ways. There are some people whose disabilities mean they are very dependent on cars. There are other people whose disabilities mean they cannot drive. So we just simply have to remember that when you talk about disabled people, and that disability tends to get weaponized by the opponents of low traffic neighborhoods. How are disabled people going to get around? Well, actually, for some disabled people, it makes it much easier to get around. And they have got to be designed so they shouldn't make it more difficult for those who are car dependent to get around. But overall, if we go back to protected characteristics as a whole, so as I say, including children, including economically disadvantaged people from different racial backgrounds who are often most economically disadvantaged, this will enable better transport planning, more inclusive transport planning. But it's important not to lose sight of people who are still dependent on their cars and to plan accordingly. But they will still gain from less other people driving on the roads if we move in this direction.
And Emma,
Thank you, Roger. Alan.
Can I add to that? Roger, you raised a very interesting point there, which is around, are we designing our places for everyone, or we're designing it principally for people who drive, by and large? And there was also a question, I think, about car dependency, not having neighborhoods and not having many examples in the UK. There are actually lots of examples in the UK, but perhaps even more in continental Europe. One of the projects I got involved in over 5 years prior to COVID was a project called Metamorphosis, which is actually about designing our cities for children. And it's very, very important that we think about designing future neighborhoods in the context that everyone gets involved in that process, because we know city design or urban planning in particular has very much been top down rather than bottom up. And we really need to consider the needs of the different groups that Roger referred to, because from the bottom up, take children, for example, they look at the world at a very different level. We call it designing at 1.2 meters, the average height of children, whereas most things tend to be designed at this level. I mean, which idiot put car exhausts right at the bottom where toddlers, walking along the street can actually breathe all this in, for example. So I think we do need a rethink, not just in devolution, but also in terms of transport planning policies that we have. And we also, very importantly, need to consult local communities and ask for their views, because when they look at things from bottom up, it's very different from top down. And if you can get their involvement, you do get better designed neighborhoods. And in fact, if I may, I'm going to post a link to the Metamorphosis project, which has several examples from continental Europe. I mean, we know what they are for people that work in the planning area, with Delft, with Germany, generally the Dutch and the Germans in some ways planned their neighborhoods a bit better than we do. And they do have high-rise communities, but actually what they don't do is put the car parking immediately outside or in the underground car park. They put it a short walkable distance away, so that the local neighborhood around the housing is actually much better with parklets and those kind of things. So I think there are lots of examples. So if I may, I'm going to post a link to Metamorphosis, which is an EU Horizon 2020 funded project that has lots of case studies. There's also good arguments around why you should design your neighborhoods for people and children in particular, rather than designing around cars.
Brilliant. Thank you, Alan.
Can I also pick up on Roger's point about national parks. I think we shouldn't touch national parks. I think the people who run national parks are actually very good at actually running national parks, because generally they're designed around nature and environment and people going to there. New Forests, for example, are about to introduce parking charges, because actually making those parks free to get to by car actually encourages people to get there by car. So actually introducing parking charges is a good thing, and I think they should have powers to enable them to do that. And if we start intruding on their powers, that's probably a dangerous thing, because they know what's best for the national park. One of the key reasons why they're doing it is because they're getting increased traffic driving to national park rather than coming by train to Brockenhurst and then hiring a bike and cycling and enjoying the neighborhood. Because a lot of the cars are actually running, literally horses for courses here, running the ponies over. So actually they want to discourage car use, but the challenge is always, how do you provide more public transport provision?
Brilliant. Thank you, Ellen. I think just conscious of time now, so I think we've got our final sort of 30 seconds per speaker just on your final wrap up points in relation to how can we best sort of design people-centric development and sort of your key takeaways from today's session. So I'll hand over to Roger first. Just 30 seconds, final statement.
Thanks. I'll use it just to kind of respond to Alan's last point. I agree, the national parks purposes are really valuable. The risk is there will still be separation of planning powers from traffic and transport powers. What would be risky would be to erode the duty of those other authorities to have regard to those national park purposes, the protection of nature and access to nature. So yeah, I agree we shouldn't touch it, but I think the risk is that the government is potentially threatening to do so. Last thoughts. Connectivity, proximity, let's take advantage of those, and let's please include, I'd reiterate my point about including some kind of proximity indicators in your local transport plan. Thanks,
Roger. And Peter?
I think it's about being comprehensive and holistic. These are real challenges, and we have to take a very comprehensive approach, and some of the changes the government's proposing will actually help to take a broader, more comprehensive view. It seems to me we've got three elements here. We've got the transport system in different ways. We've got the physical land use structures that we have, but we've also got the people, organisations that actually, as I say, provide goods and services that have a big influence on where, when, and how we travel. So it's having that as part of one big system and picture, and having the ability to get these to work together. Thank you.
Excellent, thank you. And Nicola?
Somebody at the beginning said this, it might have been Roger. Somebody said policy isn't strong enough to make us do things in the right way yet, but I'd also say it's not strong enough to force us to do things in the wrong way either. So it's our choice how we plan places. And I think we need to think about what we're measuring, measure more things, measure them better, think about the data that we're feeding into what we're doing, and kind of take on some of that responsibility ourselves as practitioners to make the change. It's not all down to the policymakers. It's not all down to the developers. We can start doing it ourselves. Nothing stopping us.
Excellent. Thank you, Nicola. And Alan.
Well, I was going to say something similar to Nicola, really. Basically, I don't think there is a one silver bullet for solving all the problems, and devolution certainly won't be the magic bullet. What I think we do need to do more is basically collaborate, as Peter suggested, and cooperate and discuss. We do need a lot more co-creation. We need to consult people bottom up as well as top down. Too much planning goes on without necessarily consulting people actually using the neighborhoods and the transport schemes and so on. But that's not necessarily going to be easy. I'm not suggesting that we consult everyone, but I think we need to do more of this co-creation, designing our neighborhoods so that, we give people what they actually want.
Excellent, thank you. And I'd just like to take the time to thank you all for attending. Thank you very much for your speakers, for your very interesting presentation and the lively panel debate. I feel we could have debated this for much longer, but it's been a really insightful discussion, so really appreciate that. Appreciate your time. Thanks also to our sponsors, Sistra and Landor, for organising this webinar. I feel we've covered some really interesting topics on the relationship between land use, planning and health, and how devolution of transport powers could impact policy vision and create healthy place making, and sort of the importance of us all taking away the importance of people delivering for people-centric development. So thank you all and have a good rest of your day.